आवाज
जी जी आवाज क्लियर है और पब्लिक बेताबी से इंतजार कर रही है।
चलो इंशाल्लाह इंशाल्लाह जी। अस्सलाम वालेकुम रहमतुल्लाहि व बरकातहू। रब्बि इश्रह ली सदरी व यस्सिर ली अमरी वहलुल उक़दतम मिन लिसानी यफ़क़हू क़ौली। Welcome everybody for this webinar. This is a very important topic which I am going to deal with. I'm going to talk about the cardiac awareness and the cardiac diseases, the status in our country, and the important aspects about this. Dil hai to jaan hai to jahan hai. So I start with this slogan. I think everybody understands how important is a cardiac event in a family, especially those who suffer. They could understand what type of devastating situation it becomes for the family when the head of the family suffers a heart attack and is hospitalized, or sometimes has a sudden cardiac death. I want to tell you, heart disease is inevitable in old age, but preventable in young age. What is the need of understanding necessary, to listen to this lecture and to participate in this? I think most of them are aware cardiovascular diseases, this is one of the main cause of death worldwide. Almost like 18 million lives are lost each year universally. And according to our Indian Council of Medical Research, approximately 60% of the world heart disease is found in our country. Even in the best of the countries, the developed nations like United States, cardiovascular diseases is it is the number one cause of death. It is United States number one killer, and so also in our country. This developed nation, they spend a lot of money on the maintenance and management of heart diseases. Almost like $500 billion they spend on the cardiovascular disease management. In India as well, it is the number one killer. Financially, it is a big burden on our country. Like, from in the 10 years budget from 2005 to 15, it was about 214 billion US dollars and expected to rise to more than $300 billion up to 2030. Now, to start with, we have to understand what gives the heart disease, what happens actually. So you can see in this, there is a cross section of the vessel, the artery, the blood pipe, which supplies blood to the heart muscle. Onto the right side, you can see a plaque. There is some, obstruction there. That yellowish thing you see, the blocked artery. Actually, this is called as atherosclerosis. It blocks the artery. Many people, they are harboring, they are having this atherosclerotic disease, and they are not aware. And it is said like it is like a RDX time bomb. So we have to look who is carrying. Anyone could be carrying this. So we have to look for it. Are we walking a time bomb? And especially in our country, we Indians we should be more worried about this heart disease. But why? Important is, we have to know our Indian genes, our Indian genetics are more responsible for this coronary artery disease. Secondly, we Indians are adapting more of the Western habits, urbanization. So what happens is, at an early age, we suffer from heart attacks. We suffer from the coronary artery disease. If we compare ourselves with the European people, with the Western people, the disease occurring in our country, in our Indian brothers, it's quite premature. It means we are suffering quite earlier, like 10 to 20 years earlier. And other important aspect we should know, the disease we are suffering is more severe in form and it is a malignant one. And other important thing is our coronary arteries are smaller in size as compared with the Western world, with the Western people. Heart attacks, actually, you see, young people are suffering these days. We see young people dying of sudden cardiac death for heart attacks. You see, 50% of the heart attacks are less than 50 years old, and 25% of the heart attacks are occurring people in less than 40 years old. Basically, what is a heart attack? We all know that heart is a very important organ of our body. I want to tell you, many may be knowing, the heart starts its function right from the intrauterine life. While we are in our mother's womb, like 40 days, our heart starts functioning and it goes on without rest till the end of our life, till the last breath of our life. So definitely the heart muscle will require good nutrition, good oxygen. So the coronary arteries, these are the blood pipes which supply this nutrition and oxygen to this continuously working heart muscle. So what happens in a heart attack? So these pipelines, these arteries, when they get blocked and they stop the blood supply to the heart muscle, that causes a heart attack. That portion of the heart muscle that becomes dead. That is myocardial infarction. And this can cause a cardiac arrest, and that can take the life. So I was talking to you about atherosclerosis. This is the plaque building in your vessels in the coronary arteries. You can see in the lower picture how the fatty deposits and that material has been deposited in the vessel and it has narrowed the coronary arteries. I think you can appreciate that. And this disease is called as atherosclerosis. This is the basic mechanism which takes place in our arteries and leading to heart attacks. I want to tell you that this process of atherosclerosis, this disease, it starts at a very early age, as early as 2 years of age. Very astonishing to know. This atherosclerotic plaque, it starts building from an early age and it takes decades to manifest. It means the heart disease starts at a very early age and manifests at a later age. So you can see how the fatty deposits, the different things they get deposited and they narrows the artery lumen. We should know what are the symptoms of heart diseases. I want to tell you, this can be from mild symptoms to a sudden cardiac death. Sometimes patients can present with, when they can be asymptomatic, it means they have no symptoms. The other very important symptom is a chest pain. Different type of chest pain, complaints of chest discomfort. Somebody, they have the description could be in different forms. Patients can have shortness of breath, breathlessness. A small exercise, a small exertion will give them a lot of inappropriate breathlessness or shortness of breath. or a severe chest pain, or patient can drop down dead within no time. Typically, you can see this picture, many times the patient can describe the chest pain, in this way. It can be a central chest pain. It can involve both the shoulders. It can, very typically involve your jaws. So one may describe this like a uncomfortable, the pressure on the chest, like a heavy weight on his chest. Somebody could say it is like a squeezing, crushing, tightness, aching, constricting, or a heavy sensation in the chest. So these are all different types of explanation by different patients. But I want to tell you, please understand this, any sort of chest pain above the umbilicus, it should be taken as cardiac. It should be taken seriously and until otherwise proved. It means what? Especially patients who have risk factors, patients who are obese, who are diabetic, who are smokers, tobacco chewers, who are hypertensive. Especially in these cases, when they say they have some sort of chest pain, we have to assume that this is a cardiac pain and you have to rush for a medical aid. Another important thing is sometimes you can have a silent heart attack. The patient may not have any sort of chest pain. This is called a silent angina, no chest pain. This is a silent angina or a silent heart attack. That's why heart diseases are also termed like a silent killer, that it doesn't show any signs. It is a silent heart attack. These are some illustrations how patients can describe this sort of pains. Now, somebody has a heart attack. You should be aware, you should know that something can stop a heart attack. We have to rush for the treatment because, please understand, time is muscle. Time is muscle means you are going to safeguard the cardiac muscle. You can save the heart muscle if you act in time. Quick action and medical treatment can restore the blood flow and save the heart. And once the heart muscle is dead, it cannot be restored. The very important thing everybody should know, especially those educated people should know, the golden hour. What do you mean by this golden hour? The time of starting of the chest pains and up to the opening of the vessel with an angioplasty is the golden hour in which you can salvage the heart muscle. You can save the total heart muscle without any loss. And that is the golden hour. If you don't waste your time, when somebody has a chest pain, you rush to the emergency room, get a ECG done, emergency doctor attended, and diagnosis is done in a proper time, and he can be given the different options available for opening that blocked artery. There are many drugs which are available to blast up, to open up these blockages. These are called as thrombolytic agents. This is a pharmacological way of treating a heart attack by drugs. And the other thing is a mechanical opening of the artery is called as an angioplasty, where in an emergency, we do an angiography to diagnose the block, and then with the wire and the balloon, we implant a stent there, we open that artery. And ideally, that should be done within 90 plus or minus 30 minutes, like within 1 to 2 hours. Mr. Mannan, is it okay? Or, I talk in Urdu, or, is this okay?
I think we can have a combination of English and Urdu. तो अच्छा रहेगा इंशाल्लाह.
अच्छा. तो ये गोल्डन आवर जो मैं बताया हूँ कि व्हाट हैपन, ये 1 से 2 घंटे का टाइम है जिसके अंदर पेशेंट को प्रॉपर ट्रीटमेंट अगर मिलता है तो वो जो हार्ट है वो सेव हो जाता है. हार्ट मसल की नुकसान से बच जाते हैं। लेकिन व्हाट हैपेंस इज हम लोग ये 1 घंटा और 2 घंटे ये घर में हम लोग वेस्ट कर देते हैं। हाँ, यू सी मीन्स हम जो वेस्ट करते हैं घर में मीन्स विद पीपल डिले दैट। क्यों हम लोग इसको ताखीर करते हैं कि भाई वी डोंट रियलाइज दैट दिस इज कमिंग फ्रॉम द हार्ट। We think the symptoms are something else, like acidity. We think this is indigestion. We think this is a muscular pain. So what happens when we think something else? We waste our time. Actually, what I have told you as is any pain above the umbilicus is taken as cardiac. So once you take it as cardiac, you will rush to the emergency room. You won't sit at home. कि भाई अगर आप सोचते हैं कि ये हार्ट का है तो आप इमरजेंसी रूम में भागेंगे, जाके ईसीजी लेंगे और सही टाइम पर आपको उसका इलाज मिलेगा। सो एक तो गलत फहमी हो जाती है कि दिस इज एसिडिटी एंड द अदर थिंग इज पीपल आर नॉट विलिंग टू एडमिट सिम्टम्स। भाई मेरे को कैसा होगा, दे डोंट थिंक कि मुझे हार्ट का प्रॉब्लम हो सकता है। दे थिंक आई हैव कम एज अ स्पेशल दिस थिंग, अल्लाह मियां मुझे नहीं देंगे हार्ट अटैक। फिर या कोई चीज समटाइम्स दे डोंट वांट टू डिस्टर्ब पीपल कि रात का टाइम हो गया, उठाओ भागो दवाखाने को, हैविंग अ फॉल्स अलार्म लाइक दिस and they don't understand importance of this. So these are the reasons where people delay it. But understand delay can be deadly. क्योंकि ये जो I want to tell you, in the best of the developed nations 20% of the people with heart attack they die within the first 1 hour. जहां पर फैसिलिटीज भी अवेलेबल है, बेस्ट हॉस्पिटल है, तो भी कुदरती तौर से पहले 1 घंटे में 20% ऑफ द पीपल विल डाई। तो दिस डिले कैन बी डेडली। हम देखते हैं घर में टाइम हम लोग इतना गुजार देते हैं, टाइम पास करते हैं, फिर लास्ट मोमेंट पे हम लोग जब जाते हैं तो ये जो ग्रुप की जो पेशेंट्स है दे डाई व्हेन यू रीच द इमरजेंसी रूम। सो इंपॉर्टेंट इज डू नॉट वेट फॉर मोर देन फ्यू मिनट्स, rush for an emergency. So we should know what are the risk factors. Like heart disease can occur in anybody, but important is those people who harbor the risk factors, they are more prone for the heart diseases. Like poor lifestyle is one of the primary factors that can make people vulnerable to the risk of heart disease, especially in people with diabetes, blood pressure, cholesterol, obesity, stress, and sedentary lifestyles. And people, because of their dietary habits, no fruits and vegetables. So, ये जो risk factors है, especially I tell like DHL, diabetes, hypertension, lipids, cholesterol, DHL. और मोटापा, स्ट्रेस, वर्जिश नहीं है, वेजिटेबल्स नहीं है, फ्रूट्स नहीं खाते हम लोग। अब what cause other than those risk factors, there are 2 types of risk factors. एक तो नॉन मॉडिफाइबल है जो हम उसको कुछ नहीं कर सकते, मिन अल्लाह है, लाइक आपकी उम्र, एज। male factor, male sex is more prone for heart disease than the female, like sex, and a particular race, and other is family history, genetics. Young patients are suffering sometimes because this is familiar, this is genetics. You cannot modify this. These are called as non-modifiable risk factors, the causes of heart disease. Then the modifiable one, like I've told you, cholesterol, tobacco, smoking, blood pressure, diabetes, obesity, alcohol, and important is stress, a type A personality. So one should know where we can modify our risk factors, like weapons of mass destruction. So these are the same things which I have quoted earlier. These are the weapons of mass destruction. Like millions are dying worldwide because of smoking, stress, alcohol, drug abuse, obesity. I will take these risk factors, a few of the important risk factors, especially obesity. If you see decades earlier, how, even in India, the farming and, the work on the field is done physically. But now, if you see, everything is mechanized by machines, tractors. Even getting a pizza is from the car. You drive through. You did not walk to get your pizza. Globally, 1.5 billion people are overweight, and almost more than 300 million are obese. Globally, 1 in 4 is overweight. So, obesity, motapa, is one of the major risk factors for many chronic diseases that leads to diabetes, heart diseases, blood pressure. More than 50% of the cases of hypertension are secondary to obesity. Many cancers, stress, anxiety, depressions can also be from obesity. Obese people have 2 to 6 times the risk of developing heart disease. Recently, the American Heart Association has labeled obesity as one of a major risk factor for heart disease. Obesity is one of the risk factor for heart disease. Please keep in mind. People who are physically active, जो लोग वॉकिंग करते हैं, फिजिकली एक्टिव रहते हैं, अपना काम खुद करते हैं, तो उनको बीमारियां भी बहुत कम होते हैं, हार्ट की डिजीज भी बहुत उनको कम होती है. People who are physically active, they reduce the risk of developing heart disease and diabetes by up to 50%. We should know our body mass index BMI, जो कहते हैं कि we should be ideally from 18 to 22.9, like, or 23. This is the Indian standards. 23 to 25 is overweight, and more than 25 is obese. In the European standards, obesity is more than 30. Like, for Indians, we are more than 25. So ideally, we should be from 18 to 23. भाई इसको देखना है कि भाई गाड़ी में जितना पेट्रोल आप डाल रहे हैं उतना इस्तेमाल हो रहा है क्या. अगर इम्बैलेंस होगा तो ओबेसिटी विल कम इन. कैलोरीज इन एंड कैलोरीज आउट. एक्चुअली हम लोग का हर सेलिब्रेशन केक से होता है. वी आर अडैप्टिंग दिस वेस्टर्न हैबिट्स. Whether it is a marriage anniversary, whether it is a birthday party, it is an exam success, it is some other successes, or any damn thing to celebrate. हम लोग हमारा कल्चर हो रहा है. We are adapting this culture of celebrating with cakes. It is such a bad food, I should say, but still occasions we are helpless. We are not getting rid of this. You can understand from this picture. Secondly, diabetes. India is also being called as the world capital of diabetes. मैं आपको बताऊं कि India is being called as the world capital of heart diseases, world capital of diabetes, world capital of obesity. Now, with the spread of fast food outlets, वही है कि Western eating habits, sedentary lifestyles, कि हर चीज mechanized हो रही है, हर चीज मशीन से हो रही है. इसके लिए the prevalence of diabetes is increasing in India year by year. अभी right now, more than 80 million Indians are diabetic. And the prediction is it's going to be more than 100 million in the next couple of years. This is basically the Western lifestyles, adaptation of the Western lifestyles. Similarly, the cholesterol, at any given cholesterol level, diabetic persons have 2 to 3 times higher risk of heart attacks. Actually, diabetes, it doubles and triples the risk of heart attacks. आप देखते हैं कि जितने डायबिटिक लोग हैं, जो chronic diabetes है, ultimately, they die of heart attack, of heart disease. A diabetic is more likely to die of a heart attack than a non-diabetic. And especially if a diabetic person, he smokes. Smoking and diabetes, it quadruples the risk of a heart attack. You know, young people who are smokers, who are diabetic, they suffer very early heart attacks. 80%, approximately 80% of diabetics, they die from heart disease. And also diabetes is the leading cause of kidney failure, lower limb amputations, then hypertension, blood pressure. It is estimated adult Indians, almost 30% in the urban areas are suffering with hypertension. Almost 30% of the population, 30% population को blood pressure है. Huge figures like 180 million was in 2000, and you know that will increase to more than 200 million in the next 2 to 3 hours, 2 to 3 years. The recommended targets are like 130 and 85, और especially जिसको diabetes है और heart का problem है, उनका जो target है, it is 120, less than 120 and 80. The third important risk factor is smoking. If you think you are smoking the cigarettes, you are mistaken. It's the other way around. Then consumption of tobacco. India is the world's second largest tobacco consuming nation. It is very surprising. The number one consumption in the world is China, followed by India. 34.6% of the adults are tobacco users. Students, day by day, you can see in the schools, junior colleges, youngsters are taking up tobacco use. Taxi drivers, professionals, what they say in a recent survey, like 70% of the college students in several cosmopolitan cities of India the students are consuming tobacco. Tobacco also contributes to 56% of the cancers and almost like 9 lakhs deaths per year in India. 275 million individuals aged, youngsters, they consume tobacco in India. Very horrifying. I want to tell you, this heart disease is preventable. Actually, death or heart disease and death is inevitable in old age, but not in young age. You should know what does smoking causes. They say there are thousands of chemicals, toxic materials, and carcinogens in a cigarette. Smokers, they say, they die 14 years earlier than non-smokers. You see, these are the different toxic compounds found in a cigarette, and you can go and see each component is so carcinogenic, can cause cancer. Single one can cause cancer. There are 4,000 of different carcinogens in a cigarette. Very important risk factors is a physical inactivity. People who regularly exercise, they suffer less from any sort of diseases. They remain free of diseases and they live longer. How does physical activity helps? It reduces the risk of dying prematurely from the heart disease. कि जो लोग एक्सरसाइज करते हैं रेगुलरली, तो वो इस दिल की बीमारियों से और इस मौत के इससे उनका रिस्क बहुत कम हो जाता है. प्लस इट रिड्यूसेस द रिस्क ऑफ डेवलपिंग डायबिटीज. ऐसे लोगों में डायबिटीज और ब्लड प्रेशर भी बहुत कम होता है. और एक्सरसाइज, पीपल हु आर सफरिंग फ्रॉम डायबिटीज एंड ब्लड प्रेशर, जो लोग को डायबिटीज है और ब्लड प्रेशर है, वो लोग एक्सरसाइज करते हैं तो उनका ब्लड प्रेशर और उनके शुगर्स कंट्रोल में आते हैं एक्सरसाइज करने से. Unhealthy living conditions and high levels of stress also appear to contribute to excess cardiovascular risk. Stress, unhealthy living conditions and high level of stress is very important. And then sedentary lifestyle is a major cause of death due to heart disease. Prevention of heart diseases. Misfortune always comes in by a door that has been left open for them. मतलब हमारी लापरवाही से ये सब मसले आते हैं. जब हमारा ट्रीटमेंट की जब बात आती है तो हम लोग घरेलू नुस्खे, हकीम की दवा, वो हैदराबाद का काढ़ा, we want to take something like this. So for my car I want the best mechanic, but for my own body I want to follow advice from here and there from friends and local quacks, and just anyone and decide for the worst. I don't want to go to the best of the hospital and the best of the doctors. Prevention is better than cure. Very important is what you eat. हम लोग को इसका ख्याल होना चाहिए कि हमारा कंजम्पशन फ्रूट्स और वेजिटेबल्स का कितना है एवरी डे या इवन पर वीक. तो स्पेशली थ्रू आउट हमारे इंडिया में the rate of consumption of fruits and vegetables is very low. This is also a very important risk factor. तो ये रिकमेंड करता है कि eat a variety of fruits and vegetables every day. कहते हैं colored vegetables and fruits. Choose low fat products or non fat products. Use less of fat meats, chicken and fish. Switch to fat free milk or toned milk. एक शायद हदीस है जिसमें आप सल्लल्लाहु अलैहि वसल्लम ने फरमाया था कि गाय का दूध इस्तेमाल किया करो और गाय के गोश्त से परहेज करो. तो आप देखते हैं कि हम लोग उल्टा करते हैं. हार्डली somebody uses cow's milk और तकरीबन 99.9 लोग बड़े का खाते हैं गोश्त. एक्चुअली ओबेसिटी कंट्रोल करना बहुत इंपॉर्टेंट है राइट फ्रॉम द चाइल्डहुड. तो बच्चों में ही हम तो इनकी मोटापा कंट्रोल करना है राइट फ्रॉम देयर हैबिट्स. बच्चों का जो स्टार्टिंग से लाइक ऑल स्टडी एंड नो प्ले, या दे आर ऑल ऑन गैजेट, वीडियो गेम्स, मोबाइल फोन्स, टीवी, ऑल दोस थिंग्स. So that leads to childhood obesity along with consumption of high caloric diet. ये सारे जो चीजें हैं बच्चे जो पसंद करते हैं जिससे मोटापा ऐड होता है, चॉकलेट्स है, ये चिप्स है, पिज्जाज है, इस तरह की जो चीजें हैं. तो व्हाट दे डू इज बच्चों का बचपने से ही उनका एक ईटिंग बिहेवियर डेवलप कर लेते हैं. So they adapt to unhealthy eating habits and physical habits as well. तो फिर आगे चल के these become an adult, obese adult, inviting all those diseases. तो हमको चाहिए कि हम ये बचपने से बच्चों का जो ईटिंग बिहेवियर है, उनके खाने पीने के तौर तरीके, उनकी जो लाइकिंग्स है, उसको कंट्रोल करना है. उनको आउटडोर गेम्स में मुब्तला करना है so that they don't become obese. Limit your intake of foods high in calories and low in nutrition. Soft drinks, junk food वगैरह, when taking extra salts, Chinese salts in hotels. I don't know how many of you knows about this. 100 ml of Coke gives you 42 kilocalories and gives almost like 10.4 grams of sugar. 100 ml. अगर ये 500 ml का कैन लेते हैं तो almost 65 ग्राम शुगर जाती है आपको, with 300 calories. सॉफ्ट ड्रिंक्स के काफी प्रॉब्लम्स है, हार्ट डिजीजेस के लिए है, बोन्स बिकम ऑस्टियोपोरोटिक, हड्डियां आपके कमजोर हो जाते हैं, डायबिटीज का रिस्क और शुगर बढ़ जाती है काफी, उसमें मोटापा है, शुगर ओवरलोड होती है, किडनी प्रॉब्लम्स है. So we should all know along with this about the soft drinks. और ये फूड्स को थोड़ा कंट्रोल करना है. फूड रिच इन कोलेस्ट्रॉल एंड सैचुरेटेड फैट्स, अंडे की जर्दी है और चिकना गोश्त है, ये सारे चीजें, मिल्क फैट्स है, बेकरी आइटम्स है, उसमें आपको लिमिट करना है. अवॉइड सैचुरेटेड फैट्स. नारियल का तेल है, पाम ऑयल है, वनस्पति घी बहुत कॉमनली हम लोग यूज करते हैं, सारे दावतों में वनस्पति घी यूज होता है. इंपॉर्टेंट इज हमने जैतून का तेल यूज करना है. दैट इज अ मोनो अनसैचुरेटेड फैट्स, दे आर क्वाइट गुड फॉर हेल्थ. जैतून के तेल के काफी ये फायदे हैं, राइट फ्रॉम योर कंट्रोल ऑफ डायबिटीज, ब्लड प्रेशर, कोलेस्ट्रॉल, जिसको एसिडिटी का प्रॉब्लम है, किसी को अपने इंटेस्टाइन के प्रॉब्लम्स है, किसको कॉन्स्टिपेशन का प्रॉब्लम है, तो ऑलिव ऑयल कैन हेल्प यू आउट in all these problems. So monounsaturated fats and polyunsaturated fats are good for your heart. जिसमें ऑलिव ऑयल हो गया, फली का तेल है, कैनोला ऑयल यहाँ तो नहीं मिलता इंडिया में, मस्टर्ड ऑयल मिलता है यहाँ पर, सनफ्लावर ऑयल एंड सोयाबीन ऑयल, एंड ऑफ कोर्स ओमेगा 3 फैटी एसिड्स जो फिश में होता है. The most important thing for the prevention is exercise. You need to do a certain level of physical activity every day. हाँ, जितना आप खाते हो उतना भी आपने पचाना है. हाँ, the calories in should be like calories out. जितने कैलोरीज आप इस्तेमाल कर रहे हो, that should be burned out. So exercise will reduce the incidence of obesity. It will also help you to control if diabetes and hypertension, blood pressure, weight loss, changes in your eating habits and physical activity. मैं आपसे कह रहा था कि जो लोग ज्यादा चलते हैं, ज्यादा वॉक करते हैं, फिजिकली एक्टिव रहते हैं.
डॉक्टर साहब,
यस, बोलिए.
हम 1 मिनट के लिए
बोलिए. यस, लिसनिंग. हेलो.
वो अतीक है, हमारे कन्वेनर हैं, बेसिकली तो वॉइस डिस्टरबेंस दिख रहा. क्विकली जस्ट विल हैव अ फीडबैक इन 10-15 सेकंड्स, और आई थिंक आप एक अगर 2 मिनट में कंक्लूड करें, देन विल हैव Q&A इंशाल्लाह,
Okay.
so that we can wrap up in another 10 minutes inshallah. Jazakallah khair.
So especially जो लोग सिगरेट पीते हैं, तंबाकू का इस्तेमाल कर रहे हैं, तो they have to stop smoking. I have told you about eating habits, control of diabetes, blood pressure, smoking, and most important is know your numbers. What numbers? आपका कोलेस्ट्रॉल कितना है? ये जितने एजुकेटेड लोग हैं उनको मालूम होना चाहिए कि आपका कोलेस्ट्रॉल कितना है. It should be like less than 150. LDL is the bad cholesterol. We should be less than 100. HDL is a good cholesterol. That should be more than 50. आपका ब्लड प्रेशर 130-80 तक रहना चाहिए. आपका वेट कितना, आपका BMI के बारे में मैंने बताया हूँ आपको. ब्लड प्रेशर आपका, अगर कोई डायबिटीज वगैरह है आपको, तो 120-80 तक रहना चाहिए. I will give you a take-home message. Please understand, heart disease is preventable and curable. इसके लिए आपको रेगुलर चेकअप्स करना होगा. Please understand, heart disease starts at a young age and manifests at a later age. Control obesity in children. बच्चों में मोटापा कंट्रोल करिए, उनको आउटडोर गेम्स के लिए एनकरेज करिए. मॉडिफाई योर लाइफ स्टाइल, जिसकी लाइफ स्टाइल जैसा बताया, एक्सरसाइजेस है, ये सारी चीजें हैं, सॉफ्ट ड्रिंक्स है, खाने में वेजिटेबल फ्रूट्स लीजिए. This is basically of, we are not modifying our lifestyle. Early diagnosis is important. अगर किसी को हार्ट डिजीज है तो early diagnosis is important to receive early treatment. फिर उसके अंदर coronary angiography और angioplasty is the preferred method of treatment. Live for today, don't stress for tomorrow. आज के लिए जियो और कल के लिए टेंशन मत लीजिए, स्ट्रेस मत लीजिए. And above all, الذين آمنوا وتطمئن قلوبهم بذكر الله ألا بذكر الله تطمئن القلوب. Those who have believed and whose hearts are assured by the remembrance of Allah, unquestionably by the remembrance of Allah, hearts are assured. This is Dr. Shawl, who is my mentor from Washington, D.C. Adventist Hospital, with whom I was working. This was in 2008. Thank you.
Jazakallah khair, Dr. Saab. That was very informative, alhamdulillah, very knowledgeable and very holistic from start till the end. You know, the risk factors, the statistics, and the precautions, and what all we have to do, inshallah, bismillah. Jazakallah khair so much. Allah Ta'ala qabul kare. And now I request everybody, please, those who haven't filled the feedback, please, the feedback form link is already there. Kindly fill it very soon and just give a thumbs up. And in the meantime, we have 6 minutes. And so I would request to our esteemed Dr. Saab, can you please take some questions?
Yes, please.
Ji. So there are some questions, Dr. Saab, in the comment section. I'll just read it out one by one. Okay, एक क्वेश्चन जो फ्रीक्वेंटली आया है कि बीपी पेशेंट कितने आवर वॉकिंग करना है?
बीपी पेशेंट
जी, बीपी पेशेंट कितनी देर वॉकिंग करना चाहिए?
Shall I answer now?
जी बिल्कुल, प्लीज.
देखो, important is blood pressure should be controlled. अगर uncontrolled pressures अगर है, then he cannot take a walking exercise. He has to first control his blood pressures. और अगर blood pressures controlled है, तो at least 30 minutes of brisk walk is advisable for him.
जी.
और actually to be more scientific, जो stress test होता है, treadmill test जो कहते हैं, so he should undertake a treadmill test. He should perform on the stress test. और उसमें बीपी का रिस्पांस देखा जाता है. When the patient runs on the treadmill, उनके हर 3-3 मिनट को बीपी लिए जाते हैं. तो उसमें देखते हैं कि इनका बीपी कितना राइज हो रहा है. If it is in acceptable range, then I think he has no problem to take this walking program. I suppose this is the answer for it.
जी. Similar question आया है. I mean, probably I think the answer is same. I'm not sure. Diabetes वाले जो है कितनी देर कितना वॉकिंग करना है बल्कि?
देखो, डायबिटीज के लिए सुनिए, डायबिटीज के लिए वॉकिंग तो ठीक है, लेकिन उससे पहले इंपॉर्टेंट उनका ABC देखना है. उनका ABC इज HbA1c, एक ग्लाइकोटेड HB होता है, हीमोग्लोबिन उनका, दैट शुड बी अंडर कंट्रोल. उनका ब्लड प्रेशर शुड बी अंडर कंट्रोल. उनका कोलेस्ट्रॉल शुड बी अंडर कंट्रोल. और इनको भी स्ट्रांगली एडवोकेटेड है कि दे शुड अंडरटेक द स्ट्रेस टेस्ट. Stress test to evaluate, because all diabetics, all chronic diabetics are taken as they are suffering from coronary artery disease. This is a very important message. Don't take it easy. 80% of the diabetics are dying of heart diseases. So we assume that they are suffering with heart disease. So they have to be evaluated. और इनके वॉकिंग में इनको दम लगता है, इनको घबराहट होती है, any sort of chest discomfort होता है, तो they should consult a cardiologist and evaluate for their heart status. I hope the answer.
जी जी. Basically get tested, मतलब आपका ये कि टेस्ट करें, अपने रिपोर्ट्स चेक करें. Okay, if anybody has any other question. एक आया कि please tell best exercises for heart.
You know, walking according to your age, if you can jog or if you can walk, a brisk walk is the best thing for your, that needs only the investment for your shoes. That is the best exercise you can do. If you can go for, hill climbing, uphill, swimming, these are all the best exercise you can take.
जी जी सही जज़ाकल्लाह. ओके, एक लास्ट क्वेश्चन हम ले लेंगे. हाउ टू कंट्रोल टैकीकार्डिया थ्रू डेली डाइट?
थ्रू डाइट?
थ्रू डेली डाइट. कोई डॉक्टर से ये सवाल है, डॉक्टर उमैमा मरियम.
Tachycardia, you have to understand what is tachycardia. Running of your heart is a tachycardia. And tachycardia is not a good sign. It is a sign of heart weakness. So, it has to be consulted. You have to rule out why this tachycardia. क्योंकि बहुत सारे उसके reasons है tachycardia के. अगर resting tachycardia किसी को है, आप बिस्तर में बैठे हैं और आपका हार्ट रेस कर रहा है, that is not a good sign. You have to rule out कि भाई आपको क्या मसला है. कोई कार्डियक मसल का प्रॉब्लम है, कोई वेल्व का प्रॉब्लम है, या थायराइड का प्रॉब्लम है. So, you have to get evaluated. It is not by any other means. अगर स्ट्रेस है, किसी को एंजाइटी है, हैबत हो रही है कोई चीज की, तो साइकोलॉजिकली अगर किसी को भी हो सकता है, तो उसमें you have to be very strong to control yourself. Otherwise, you need to consult a proper doctor and to evaluate your tachycardia. ये डाइट वाइट से कंट्रोल होने वाला नहीं है, दिमाग से कंट्रोल हो सकता है. ऑफ कोर्स यस.
सही जज़ाकल्लाह खैर. एक और एक क्वेश्चन है, जैसे क्लास ले लेंगे हम. हाउ टू कंट्रोल पैनिक अटैक्स?
अभी मैंने एक आयत पढ़ा हूँ कुरान की, तत्मइन्नुल क़ुलूब अला बिज़िक्रिल्लाह अला बिज़िक्रिल्लाह तत्मइन्नुल क़ुलूब, कि भाई अल्लाह को याद करो और फिर आपको उसका सुकून मिलेगा. कि डोंट स्ट्रेस. आप स्ट्रेस लेते हैं तो ये सारी चीजें होती है. तो यू ट्राई टू कीप योरसेल्फ कूल एंड काम. कि भाई किसी से आपका झगड़ा होता है, किसी से नाराजगी होती है, तो यू ट्राई टू फॉरगिव देम, फॉरगेट एंड फॉरगिव. ये जो अपने हदीसों में जो चीजें बताई गई है, दैट इज वेरी इंपॉर्टेंट एक्चुअली. तो अपने को अपने दीन का सहारा लेना है इन चीजों के लिए. कि भाई अगर भाई आप रिक्शे में जाते हैं, उसको कुछ 1 रुपया देने से उसका झगड़ा हो जाता है, दिन भर खराब जाता है आपका. किसी से बहस कर लेते हैं आप, तो दिन भर चला जाता है आपका. So what you have to do is you forget it. Am I right?
सही सही बिल्कुल.
So you try to forgive and forget.
सही.
आप स्ट्रेस मत लीजिए, और मतलब you live for today. कल का किसने देखा है? Don't stress for tomorrow. I think that will give them the.
Jazakallah. Actually, all interesting questions are starting, but this will positively the last question hum lenge, but it's very interesting. How to differentiate between heart problem and gases when ye acidity samjhe?
Acidity.
No, how to differentiate between heart problem? Yes. जब पेन होते रहता है, हार्ट का है या फिर एसिडिटी या गैसेस है? जी जी. सिमिलर रहता, तो how do we differentiate? एक मिनट.
Very good question. And it is very simple actually. सबके लिए मालूम होना चाहिए कि भाई कोई भी पेशेंट को अगर चेस्ट डिस्कम्फर्ट हो रहा है, तो इज इट अ रेस्टिंग डिस्कम्फर्ट या एक्सर्शनल डिस्कम्फर्ट? पेशेंट अगर बैठ जाता है तो आराम लगता है, जब वो एक्सर्शन करता है, कुछ हरकत करता है, और जितना ज्यादा एक्सर्ट करता है उतनी ज्यादा तकलीफ होती है. तो दिस हैज टू बी वरीड, दिस कुड बी कार्डियक, राइट? और resting discomfort hai, it is not related, like acidity, it is not related to exertion, to walking or to position. कोई पोजीशन लेने से अगर आपको तकलीफ हो रही, तो ये मस्कुलर आपका हड्डी का रिब्स का ये हो सकता है, मस्कुलोस्केलेटल ये हो सकता है पेन. लेकिन कार्डियक पेन रहेगा तो एनी एक्सरसाइज, एनी एक्सर्शन विल एग्रीवेट द पेन. रेस्ट विल गिव, when you take rest, the pain goes away. You feel better when you rest. Perspiration आ रहा है, पसीना आ रहा है, घबराहट हो रही है, चक्कर हो रही है, बाथरूम जाके आने में और परेशानी, दम लग रहा है. So these are not from acidity. Acidity can be at rest. And अगर आप वो इनोसॉल्ट ले लेंगे तो you feel better. लेकिन कार्डियक का होगा तो इनोसॉल्ट से you will not feel better है, no? So this is very easy to differentiate exertional and resting pains.
जी, that gives so much clarity, माशाल्लाह.
Yeah, yeah.
और काफी कॉमन क्वेश्चन है, समझिए. जज़ाकल्लाह खैर डॉक्टर साहब, अल्लाह ताला कबूल करे, आप वक्त
Ameen.
निकाले, एंड so much I mean beneficial knowledge, अल्हम्दुलिल्लाह. अल्लाह ताला जो है हम सबको इस पर अमल करने की तौफीक अता फरमाए, and may he protect us all from all kinds of diseases and especially heart diseases, biiznillah. A quick introduction about AMLC before we end up. So AMLC Abdul Mannan Life Coaching, alhamdulillah, we are providing लोगों को जो है online courses as well as webinars and workshops on contemporary topics with Quran and Hadith as the base. So we have covered pretty much lot of topics from happy married life and effective parenting through Quran and Hadith, and time management, and alhamdulillah several topics. So you can visit our YouTube channel, and inshallah आप जो है उसमें almost 400 plus videos बिस्मिल्लाह आपको जो है मिलेंगे. Jazakallah khair everybody for your time, for your patience. There was a technical glitch, so we started a bit unexpectedly late than normal, but alhamdulillah, biiznillah waqt mein barakat rahi and things have been covered up, inshallah, biiznillah. Taqabbal Allahu minna wa minkum, everybody. Jazakallah khair wa akhiru da'wana and alhamdulillahi rabbil alameen. This session will be open for 1 minute or two for any messages in chat box can be addressed. Jazakallah khair everybody. Jazakallah khair Dr. Saab once again.
Most welcome anytime. My pleasure.
Ameen.
In addressing. Thank you for listening.
Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.